All right. Ladies and gentlemen, welcome to the second episode of the Healthcare Growth Cycle podcast. And it is a privilege and honor to have on a really awesome guest today. From a podcast angle, I was thinking a lot about this, and I got to work under Mike, your leadership during the COVID days with Updox, starting pre-acquisition all the way through. But yeah, ladies and gentlemen, we have Mike Morgan on, former CEO of Updox and serving on a number of different boards for healthcare technology companies now. And again, Mike, it's just awesome to have you on and get in today about that crazy journey during the COVID pandemic. And, I was on the data side as a lead BI analyst, and you were leading the initiative all the way to a successful exit. So just to have you on the Healthcare Growth Cycle podcast, this is a really, really fitting episode, and it's just awesome to have you here.
No, thank you, Christian. It's fun to be here, and I feel bad now after seeing your Updox shirt. I should have dusted off one of my old Updox shirt to wear today. So I still do that every once in a while just for nostalgia.
Yeah, no, I had to wear it today. It wasn't an option. I was like, this is just fitting. So yes. All about the brand. Yeah, just right out of the gate, if you want to kind of give a little bit of your background and journey into how you got into product, technology, and then specifically in healthcare that led up to Updox. What were some of the positions you held and experience you had to get ready for that role at Updox? I think it'd be really useful to our listeners.
Yeah, no, that'd be great. And I'll keep it brief and then we can go through. But actually, the whole career has been in technology. I actually started out in market research. My degree was in math in college, and so that was kind of my way into technology. And then was fortunate to get into product management pretty quickly in a fairly large organization called Sterling Commerce. And it really gave me a flavor for just, managing a product, kind of the starting and managing a business. A few different startups, probably for a whole different podcast, some that went well and some that, didn't go so well, but learned a lot from those. And then, got into kind of healthcare technology, I would say in early 2000 with a behavioral health EHR. Ran marketing and product. It was we served kind of larger enterprise organizations, but it was a great experience. We was able to recap the business a few times, scaled it, and then had the opportunity to join Updox, and just love that business. The market we served, independent physicians, such a critical part of healthcare, typically overlooked with technology. And I think this is going to be an interesting part when we talk about growing a company, because I think it's a market that is usually overlooked because everybody wants to focus technology on big hospitals and people that are going to pay millions of dollars. And they shy away from serving healthcare where there might be less money in each new customer, but it's still a super valuable part of the business. And it takes kind of a different run. So we served independent physicians, gave them a platform to consolidate all their communications, and, an amazing business. We were able to, I think by the end, over 5,000 customers, a couple 100 million patients that they were serving. And, really became, really a de facto standard for how those physicians communicated with each other and with their patients.
Yeah. So I joined, in November of 2019, and I just would like to learn a little bit more, maybe selfishly, about the journey leading up to March of 2020, which we all know what happened in telehealth in March of 2020. But can you give any background on some of the biggest bottlenecks that you were up against in telehealth prior to COVID even happening and that boom?
Yeah, it was interesting. So telehealth, and even to back up from that, the company really started by eliminating paper and replacing that old-fashioned fax. And so what that did is that gave Updox a great position because we were in the workflow. So both the front office staff, the clinicians, anybody in that office used Updox because paper was kind of the foundation. Referrals were coming in and out, prescriptions, lab results. And along that way, we said, hey, it would be great in this one kind of consolidated way to communicate. There's also the patients need communicated with. And 70% of all communications with patients typically initiates from a document. They get a lab report. They need to give you the update. They need a referral. They need to reach out to you. So we started this whole suite of patient engagement tools because it just made sense that we always said we wanted those people working in that office to have to touch things one time. So if a document came in, a lot of times before Updox, they'd put it into a queue, then they have to come back and do the work later. What this did, this gave them this basically efficiency, kind of before AI, before all the others. We could tag things and we could set up rules, and they would do that. So just one natural way to communicate was video with a patient. Now, what was interesting is pre-COVID, we were doing 50 telehealth sessions a day across the entire customer base because nobody was really using it at that time. It was just this add-on, and they would do it. And so at the height of COVID, after everything shut down and the doctor's office had to start using telehealth, we were doing 55,000 sessions a day through the platform. So just to add order of magnitude, kind of that 5,500 a day to 55,000. So.
Yeah, which is a stat that I've thrown out in interviews and whatnot with potential clients for the volume of video chat data that we were reporting on in Looker that Heath and I were dealing with.
Yes,
so that was,
yes.
Yeah,
yes,
yep,
yes,
yep.
yes.
That's
And
crazy.
what's interesting is just, you brought that up with you and Heath and the data team.
Yeah.
That was such a critical point because we were trying hard to figure out where it was being used, how it was being used. If you remember too, we weren't even sure how to price it at scale and at volume. And so we were trying to understand. And so we had this big mix because we didn't want to overcharge because, there was a situation where people needed it, but we couldn't undercharge because we had third-party costs sitting behind the product. And so there was a lot of effort to try to find that balance. And the data was huge to be able to do that. So the work that you and Heath and team were doing, was super critical because without that, we wouldn't have known how to roll that out and how to manage that at scale.
Yeah, no doubt. And I remember the pricing changes a lot. I have, just historically speaking, and maybe even currently, have you gone through quite a few pricing changes in healthcare companies with different products? And I guess walk us through some of that process maybe. What's the reason for the back and forth and consideration on pricing always having to change in healthcare SaaS technology?
Yeah, no, I mean, that's probably the most important part with data is trying to find that price point, right? And I do think the challenge starts to become, how do you price it in the way that the customer sees value? And so, for example, and you have to balance that on your back-end third-party cost, right? Because if a company's delivering a SaaS solution, but they have back-end costs, and AI is a perfect example of this. Some of the other companies that I'm working with now, you pay a lot of these AI language models, by the time or by the minute that you're leveraging those models. If you have the other side of it, the customer doesn't want to pay by the minute, they just want to use the product. And that was similar to what we were facing at Updox too. We had back-end telecom costs, but yet they saw the value by the number of pages that they would transmit or how much use that they would have by per patient. And so we were always trying to find the balance of how do we use data and understand how the customer is actually using the product.
Yeah.
And then how can we marry that with our back end costs, but put together a pricing model that not only makes sense to the customer, but the way that they equate using the product to value, but still protects the company with the back end third party cost. And those two things don't always align. If the third party cost is by the minute, the customer likes to pay by the minute, everything's great, you can build your margin. But a lot of times those two things don't necessarily line up. And then it creates this whole need for data to understand how cost and how usage kind of works together.
Yeah. Would you say that was one of the biggest challenges of the shift in COVID and the go-to-market for Updox's value, besides just being an e-faxing platform and now expanding into those telehealth solutions during COVID? Yeah.
No, I'm sorry, good.
No, go ahead. Yeah.
No. I was going to say, that was definitely a big challenge. I would say, though, it also comes back to the pricing. We worked a lot to how to unbundle the product, too.
Sure.
Because if you remember, you would buy kind of the platform, and then you would have all the modules and pieces that came together. What we saw during COVID was people really just wanted to buy pieces of it to be able to get going and do. So, kind of during COVID, I mean, we were onboarding kind of 10 times the amount of customers a month that we normally would.
Yeah.
And so a lot of that was, okay, how do you unbundle it? How do you get them through that process? How do you get them trained? How do you get them actually up and running and using?
Yeah. So just more of a leadership question. What was it like leading an organization during this crisis, during this COVID pandemic. And if I remember, we kept headcount pretty much the same.
Yep.
So the capacity constraint on the sales team, the data team, obviously it was a lot heavier. How did you go about leading that so effectively to have the success that we had?
Yeah, no, I think it's a testament to the team and truly, mean that. I think the thing that probably helped us the most was we had a great team. I think 95%, were in the office together before this happened. We didn't have a lot of remote workers prior to COVID. And I think, we had a collection of people that were really bought into the mission, not just what we were trying to do to grow the company, but the people we were serving, back to those independent physicians. And we had worked a lot, when we would sell a new one, we would get them up to speed. People really, cared a lot, about the customer. So I think when COVID hit, it was interesting managing through it because, and it's hard to remember because, it's been a while now. It's a little hazy.
Yeah.
But, you had the concern for the people and we had concern for each other. And we had a lot of people whose partners and spouses were first responders. And so if you remember at the time, there was a lot of unknown just about the dangers of that. We had people who had kids that were at home trying to be schooled at home. So everybody had all these personal situations that we were very clearly worried about for the people. Then at the same time, you're trying to balance the business side of it. Now, what I will say, and I've heard this from several people, and I felt like this personally, I think the fact that our business was getting so busy actually turned out to be a thoughtful and a nice distraction from some of the things that were going around in the outside world. And so, if you remember, we were trying to figure it out. We were doing town hall meetings every day. The managers were doing meetings every day, with the departments. It was new. I'd never managed in a remote environment. A lot of our managers never did. A lot of the employees hadn't worked in a remote environment. Remember how awesome a job IT did at getting everybody's equipment at home. People went in and picked things up. We were trying to figure all that out new. But, I really truly think it was just a testament to the people that we had, the way they cared about each other and about the mission. But I feel like we learned a lot through those.
Absolutely. And just the passion for the product and how we presented it in that time to all these providers. I mean, I just remember so many conversations with my parents even about what we were doing and the work we were doing. And I don't know if they fully realized the industry that I was in and just the level of impact that we had. And it was just, as I got to talk to my family members and to my friends, it was always like, I'm truly with a group of professionals that are doing work that's moving the needle, to help with this whole crisis. I mean, it was really still the coolest experience of my career. And I don't just say that, it's always something I fondly remember and think back to, when we had that opportunity. So that's really insightful.
No, it's great. It's great to hear that. Yeah. And we always struggled too. I think we always talked about it, right? I mean, clearly there was a lot of pain and suffering during that time. The fact that our business was doing well, we really did feel like that was our time to give back, right? I mean, because you remember the story, there were 55 charity care clinics in North Carolina. They shut their doors and they contacted us and we worked over the weekend. And I think we had some 40 of those reopened on Monday who were doing all 100% telehealth at the time, on that Monday. So, I mean, it was definitely, incredible. Stories like that. Yeah.
Yeah. Well, that's great. So I guess fast forwarding to now, right? There's been so many advancements in AI, and actually one of the prior podcasts I did was really focused on AI governance in healthcare. And I know the EU AI Act is a big thing overseas. And obviously we have HIPAA, high trust here. And I get shaky as a data consultant in healthcare when we think about leveraging these AI models in, with PII, PHI data. I mean, it really puts me on edge. You really can't just be using an open public LLM for healthcare data.
Yep.
I guess, what kind of changes have you seen, maybe specific to telehealth or just healthcare technology in general with EHRs, companies that you advise now? How are they thinking about AI governance when it comes to HIPAA and regulations and whatnot? I'm just curious if there's any topics that come up on that front.
Yeah, I mean, it is. And we'll kind of take it two different paths and then we can kind of talk about it. I do think there are the internal tools that these organizations are using to try to make their employees more productive, right? And, whether that's in development or whether that's on the sales front and the marketing front, right? There's a host of number of tools that do specifically have the potential to touch PHI. So
Yeah.
I feel like most of them are putting together processes where the security and compliance groups or, the technology side, those tools have to be vetted. The individuals just can't choose and push data, to those. So there is governance and processes for approval there. It is interesting, I think, on the then customer facing side, I do feel like there is becoming a distinction between tools that help with the administrative functions and then what I would consider more clinical decision support AI.
Sure.
And, that goes down a whole other host of, path because there it's like who validates their recommendations, or if it's creating a treatment plan, or if it's creating a diagnosis or a clinical pathway. Like that's a whole other subset. So I do think there's kind of three big pieces. There's the use of internal tools, there's the use around administrative functions within healthcare, then there's the clinical bucket within healthcare too, and they all have a little bit of a different nuance.
Yeah, I guess, can you talk on any use cases at a high level for like clinical AI? I'm just curious because I've had some conversations with some other telehealth companies on how they're using AI to help with video telehealth. And I'm not going to get industry specific because that might give it away. But yeah, I'm just curious. And same with you, but I'm just curious what kind of things are on the horizon there.
Yeah, I mean, I do think a lot of it is on that, kind of think about it as automating the front door into healthcare. So is it symptom? Is it assessments? It's determining, the acuity and the clinical pathway, for that patient. I do think it's across all different parts of healthcare then. So think about like the whole patient journey. There's typically the assessment and intake as you're coming in, and then there's the clinical session. So the hottest thing now is the ambient listening, where you're basically turning it on. And there's a lot of companies that are doing this. And so, some companies are building it in, some are like leveraging third party. But in general, so, you're talking about this, it's basically sitting there in the old-fashioned scribe days where you would have an automated scribe, or a lot of times it would be a person where you just have an open phone line, or you're recording the session and then a scribe actually physically on keyboard translates it. Now you're just recording it. And then that audio file then gets utilized, and AI kind of utilizes to summarize the notes and help make recommendations on a treatment, a course of treatment.
Yeah. Wow. Yeah. I'm just trying to think. How about value-based care? Like, have you touched on value-based care? Are there any AI applications with what you've currently seen in the healthcare technology companies that you're advising, or just other conversations you've had? I guess what's your thoughts on that? And then on top of that, just back to Updox. So this is, I guess, a loaded question: was value-based care even a popular topic of discussion during 2020's like 2020 COVID time?
So. Yeah, probably a couple of different things there. The first one, I mean, definitely you're starting to see, so value-based care, Medicare Advantage, it's starting to, you had some early pioneers on it. It took a little bit of a lapse. You are seeing it start to come back now. I think where AI you're starting to see, come into fashion is kind of what I would consider more around care management. So if you think about your patient population, part of value-based care is you're getting a capitated amount of money to take care of this patient. And so you have to do a good job of assessing that patient, automating the outreach, making sure that, they're getting the wellness care, or, or they're doing the things that they need to do, because clearly the goal is to keep healthy. And if they stay healthy, it's better for the patient. And then, theoretically, the provider is going to do that for less cost, and they're going to be able to share in the rewards. And so I think what you got AI doing is just starting to be smarter about how you keep track of that patient and how you automate some of that outreach. And, you're seeing some interesting things because it can stratify the patient population, and it could maybe say the best time to outreach to a single mom is, or a single parent, single dad would be, between noon and 2 in the afternoon before the child gets off of school, right? So you're starting to see some intelligence and some automation, come around.
Yeah. And was that a topic of discussion. Like, I guess maybe even asking this, did Updox help at all with value-based care with the solutions that we had?
Yep. So we kind of did it two different ways. And so if you remember, we had two sides of the business. We had one that we sold directly to physicians where they used the platform. We did have a lot of other technology companies leveraging our communications capabilities through our APIs on the back end. And so we did have several kind of large accountable care organizations that would use our platform to help collect clinical records from other community providers. So, what I mean by that is you had the ACO sitting there, they would build their clinical dashboard. They would use Updox to go and be able to transmit files from the local health systems who ran Epic. They would be able to then be able to transfer those records using our direct messaging and our other communications protocols. And so, we were doing that on the back end. On the front end, going back to the conversation where a lot of things happen with document exchange and the telehealth piece, we were doing things where we were helping a pretty large organization that was at risk. They were full value-based care at risk, and they were partnering with local health systems. And what they would do is they would do what they were just calling kind of quick consults. And so if a patient came in and you're the primary care physician and, somebody, had a question or they had something and you as the primary care weren't quite sure whether this really needed a referral. If you made that referral, they would go to somebody outside the network, and then you as the person at risk or the organization at risk for value-based care would get charged that amount of money. So clearly you wanted to do what's right for the patient. If they needed that referral, clearly you'd make the referral. If they didn't need the referral, you don't want to make that. And so what they were doing with Updox is they would use telehealth, and they would basically get that referring specialist on, and do a quick consult, sometimes have the patient there, sometimes do it when the patient's not there, be able to do kind of a quick consult and then make the determination whether that referral was needed or not. And so what that was using basically the infrastructure of the telehealth. They were able to do those quick consults, significantly reduce the unneeded referrals, which reduced the overall cost, which improved the margins for value-based care. So, and we were starting to do some of that work, but that was a perfect example of how you use telehealth in a platform.
Thanks for all that background context. I think that's going to be really useful because I know value-based care is a really hot topic in healthcare too right now, especially at least just the podcasts and other resources I've been learning about and listening to. I'm eager to encounter it a little bit more on the data side. I haven't really admittedly seen a ton of value-based care data initiatives, but that's super helpful for how we'd actually use the Updox platform to help with it. Now back to the leadership front. So covered some AI things, covered value-based care. In the leadership front, thinking back to when you first founded Updox with your co-founders, what are 3 traits that you could attribute Updox's success to? I'm kind of putting you on the spot here, Mike, but I would just love for you to break down just kind of that journey of starting with a very small startup team and then scaling it to that successful exit that we had in 2020. What are 3 characteristics of a successful healthcare company that could scale to that level?
Yep. And I was always careful of this, even when I was at Updox. I want to make sure, I was actually technically not a co-founder.
Okay.
I just want to make sure. So Mark Sherry, along with Mike Whitting and Tobin, they were the co-founders in the business. So, I came in super early and ran it there, but I did just want to make that
Thanks for the clarification. Yep.
In case Mike and Tobin are listening, I just want to make sure. I think, there's probably a couple things. It's, getting the organization right and determining how to scale the organization. I'll kind of start there that. I think that's number one, because when you're early, there were only kind of 4 or 5 of us early on, right? And you start to grow and add people. Clearly early on, everybody's doing everything. People are wearing multiple hats. You can't go from that to the end organization where everybody's specialized in one leap. So you have to be thoughtful about which positions you hire, where do you specialize, where's it okay to kind of keep people, there. And we were super fortunate. A lot of our first hires were people we had worked with before out of our network. So for my previous company, there's people that Mike and Tobin had worked, with before. And so, that really helped. But I think, getting that organization right and figuring out that just the job function specialization and how you scale that. I think, the other piece is really focusing on marketing and making sure you're building the demand for your solution before you just try to go hire sales reps and scale. This is Updox. These are the other companies that I've been working with. A big mistake I think a lot of companies make, they try to hire a salesperson and think that's going to be a hero salesperson, and they're going to go out, they're going to leverage their network and just sell. So you might be able to get a couple deals that way, but that's not a sustainable, really kind of growth model.
Sure.
Versus, hey, you got to make sure you're listening, understanding the base, understanding the customers, making sure you're marketing the right way, align marketing, and be able to generate the pipeline and demand. And then sales follows that piece. So I think that's super important. And then I think the other one is the third one is then I think just very thoughtful investments in growth, keeping an eye. It's like, how do I think about when it is time to start growing the business? When do I go to a new market? When do I make a product extension? How am I thinking about making those ultimate investments? Because, and if you remember, we talked a lot about horizons. The Horizon 1 was our core business, and then we were thinking about some of the future. And that's how we got into some of the newer markets like pharmacy. That's how we got some of the newer products like patient engagement and telehealth. And then you do that. So I think, you get the organization right. You focus on building the right kind of demand in the market for your product, and then sales will follow. And then you're thoughtful about the way you scale the business, whether it's new product or kind of new segments, and thinking through that. And don't get too far out over your skis.
Yeah. So were you doing a lot of product management then starting out? I mean, were you holding customer interviews, studying?
Yeah, I think basically everybody in the company, we were doing a lot. I mean, Mike and Tobin and team had done a lot of that. Adam Coltnow was he had kind of worked on the product kind of pre-launch. Okay. Those guys really did a, nice job of kind of setting that. And then, yes, I think, everybody's that's kind of what, everybody is, focused on that part of the business. I think really understanding the customer.
That's incredibly insightful. I mean, especially you had said many companies make that mistake. It's I've heard the quote, sell before you build and your future's built. But I think focusing on the product is the longer term growth. So that's a value bomb. I really appreciate that.
Yep. And then I think the biggest thing underlying all of those, you said 3, so I'll add a 4 here though for you too.
Yeah,
but it's underlying them. I think you need to have the right kind of thought on what's the goal of the company, and have you capitalized the business the right way to meet your goal with the right capital partner. There's clearly different ways to build a business. You can bootstrap a business. You can go raise a lot of money,
right?
And try to grow it that way. What I would typically say, there's really no wrong way to do it. It's just if you get out of alignment with the founder and the original or the goals of the company and how you're thinking about growing the business. If you think you're going to take over a massive market and compete with people that raise a lot of money and you're going to bootstrap, it's really hard, right? So if you want to bootstrap it and you're okay growing it to a certain level and you're trying to make a certain income or build a certain value in the business, that's okay too. It's just, you just got to make sure that your capital strategies align with what, the collective goals of the company are.
Great insight. That's awesome. How have you gone about introducing adoption with healthcare technology? I mean, just from my perception, right, healthcare I call it a traditional industry. I think right now with the influx of healthcare technology, maybe in the last decade, it's maybe a lot more accepting of these solutions. But was there resistance when you first launched the Updox product into the market? Was the adoption challenging? I guess walk me through that a little bit.
Yeah, and I do think, healthcare is unique, right? I mean, they talk about it as a market, but there's probably 100 subsegments.
Subsegments, yeah.
In healthcare. Yeah, the thing that we did, which I think is a good way to build a business, we used to talk a lot about leveraged distribution. So if you recall, we partnered with a lot of EHR companies, and that was one way. So I think one strategy is to go out and build the demand directly yourself, and we were able to do that at some points in the company. But if you look, we did some early partnerships with some electronic health records where, that's the core system of a lot of these organizations we were trying to sell to. That really helped us, and we got a deeper integration with them. And then a lot of times they would recommend us to the customers. And so, that would pull through. Now,
Yeah.
you gotta weigh because, part of it is you do have to pay them money. A lot of these EHRs have marketplaces and other things. So the way we always looked at it was there was a certain cost of sale, cost of marketing, cost of lead if we went out and generated it directly, or we pay these EHRs. And we thought, okay, that is similar to our cost per lead.
Yeah. No, that's a really good point. It reminds me of just being a consultant and getting leads through like a data integration partner.
Mm-hmm. Yeah.
Or even building a product as a consultant, like a data platform. And then, if you build the product on a vendor, they're going to obviously want a piece of that pie.
Yes.
Yeah.
Yeah, and it typically makes the product more valuable, right? Because you have a deeper integration.
Yeah. A support team too, if something breaks.
Yeah.
Especially in data integration where things break all the time.
Yes.
No, that's great. No, this has been great, Mike. I know I try to keep these around like 30 minutes, so I think we're kind of at that time. But I guess if there's one, maybe a cliche question, but if there's like one piece of advice for motivated healthcare, health tech, startup founders that are either have already started or they're thinking about starting a healthcare company, what's a piece of advice that you can give them on the ground floor as they delve into this huge journey that's, not an easy one?
Yep. No, so I'll answer your cliche question with a cliche answer. But I truly believe it. You got to surround yourself with the right people and the right team. And, whether you're ready to have a co-founder or you're ready to bring in the management team, or, you're looking for a financial or a capital partner or looking for a mentor, like you got to have the right people around the table and not be, scared of doing that and growing. Because I have seen a lot of companies with really good ideas and really good markets, but they can't get out of their own way because they either think they know what they're doing and they won't listen to advice, or they won't surround themselves, or they're maybe, too insecure to bring in strong people. There's a whole host. And it's like, when you think about it, it's like the market has to be good and there has to be a need. You've got to either have the idea or have the proof, and you have to have a really good product that people really want to use. And then you need the team to be able to go around and execute. And then under it all, you need to have the right capital structure. And so when you think about things you can control, you got to pick the right market. You got to make sure you're doing the right product. But like getting that team and scaling and getting the right people around to grow the business. I don't think there's anything that's more important than that.
I love it. Yep. That's I guess just paralleling it too to me. I'm trying to go about my data consultancy as an agency model, get people in the right seats, and so I really, really appreciate hearing that. If people want to get in touch with you or just follow you, where would the best place be to do that? Just a little plug for you.
Yeah, no, the best place, right? Like into now, the most active is on LinkedIn, so that would be the best place to find me.
Great.
Happy to connect.
I'll plug your link into the show notes. And
that'd be great.
Awesome, Mike. Well, thank you so much for coming on. Ladies and gentlemen, this is episode 2 of the Healthcare Growth Cycle podcast. We will see you on the next episode. Thanks a lot.
Great. Thank you, Christian.